There's a new warning this morning about dangerous mixtures of prescription drugs. A report finds almost 60% of Americans who take opioid painkillers combine them with other prescription medications, and that is potentially a deadly combination. Dr. Holly Phillips is here to explain the risk. Good morning.
Good morning, Nora.
Okay, let's talk about exactly what this is. What are the opiates and what are they combining them with that's so dangerous?
Sure. Well, these are what we call opioid painkillers. They include things like codeine, morphine, and brand names like Percocet and Vicodin. These are the drugs behind our prescription drug abuse epidemic in our nation. Now, more people die from overdose of these prescription drugs than from cocaine and heroin overdose combined. That gives you a scope of how much these drugs are abused.
How are people getting their hands on these drugs?
Well, you know, one of the things that the survey found today was that not only that people take these drugs in combination with others, but people who take the combinations most likely got them from more than one doctor or filled them at more than one pharmacy. It's a technique, we call doctor shopping, where the patient gets a prescription from several doctors and the doctors aren't aware that each is prescribing.
There's no way to cross-check the doctors?
Well, you know what, Gail, that's a really important point. There is now a prescription drug registry in 49 states. But it's underutilized. We doctors don't use it enough, and it's also not perfect.
Right, and just to clarify, they're taking these opiates at the same time that they're taking medicines for high anxiety and other drugs.
Exactly. You know, there is a combination that's commonly abused. It's called a Houston cocktail. It combines benzodiazepine, which is an anti-anxiety medication, a muscle relaxant, and a painkiller. It's particularly lethal. You know, all of these drugs slow down our ability to breathe, and they act on multiple receptors in our nervous system. They can be very easily overdosed on.
So the ultimate question is, what do you do if you're concerned about this?
You know, we doctors need to prescribe less, and actually a survey out today of primary care doctors shows we're doing just that. 45% said they prescribed fewer of these drugs last year, and we're also recognizing the problem. We need to be more reticent in prescribing, and patients need to be more reticent in taking.
Thank you.
Thank you.